Looking for a professional office space that makes it easy to focus on growing your business? At J. Kenba Executive Suites, we offer turnkey office solutions with stylish furnishings already in place so you can walk in and get right to work. Our leases include access to Wi-Fi, managed building access for security, on-site parking, utilities, and regular cleaning services, giving you peace of mind and a workspace that's always clean, secure, and business-ready. Whether you're a mental health professional, insurance agent, notary, or other service-based entrepreneur, we provide the professional environment and amenities you need to impress clients and operate efficiently. And if you're not looking for full-time office space but need a place to host a workshop or small meeting, we also offer conference room rentals, perfect for off-site meetings, trainings, and workshops. Schedule your private tour today and see the difference for yourself. Visit jkenba.com. That's www.jkenba.com to learn more and reserve your space before it's gone. At J. Kenba Executive Suites, we provide the professional space. You create the success.
Welcome to the Byja Radio Show. I'm your host, Dr. Byron Jasper, and we are recording live with special production by Becknell Media. All right, we are back in action at the amazing Byja Radio Show. I have the one, the only co-host with the most, Mr. PatientZero, in the seat with me. And for people who may not be aware, PatientZero is not only a co-host, but he is an amazing person just overall. I like to say that if I am the gumbo of Byja Radio, this is the roux. That is PatientZero. If I'm the grill, PatientZero is the seasoning on the food. Like, he brings it all full circle. And of course, if I am the stethoscope, PatientZero would be that heartbeat, just making sure that we have a pulse in this thing. So PatientZero, how you doing today, brother?
Man, I'm doing a lot better after that fantastic introduction, man. You know, it's a challenge to get a good roux. So calling me a good roux, man, that's one I'm gonna take to the bank, man. You put that on my headstone, be like, he was a good roux.
There you go. People would be like, how did we even get to this point? Just don't ask questions. Just go ahead and go
Yeah,
with it.
man,
That's what
it
we're going
just
to tell
is what it
people.
is.
That's
Yeah,
exactly.
man.
Don't ask
How
questions
are
that you
you?
don't need details to.
Yeah, at all. But how
There
are
we
you
go.
though?
Doing good, brother. I think we got a topic that is timely because a lot of people aren't aware of what the organ is other than to know they have this organ. And then I
hmm
also, of course, oftentimes will pull topics based on not only what's going on from a current event standpoint, but also because things that happen in my clinic, right? The clinic obviously has patients that come for various reasons. This one came because I literally have a patient that is dealing with this in this moment as we are recording. And it's unfortunate because I had to literally send the patient to the hospital within the last week or so, just based on kidney disease and kidney disease alone. And by us talking about this, I think it'll be helpful to keep people honest on what the kidneys are, how they work, what they're supposed to do, and more importantly, how do we know when there's disease and how do we treat it? So I think the idea for me is we're not only doing this because it's entertainment. Of course, we're entertaining. I think that's goes without saying, but it's also educational, right? So before we get started and kick things off, PatientZero, I will always start obviously with a very intriguing question. What do you know in terms of kidneys from your
hmm
background prior to being PatientZero? Anything at all that you'd like to share with the people about kidneys from your expertise?
Well, I do know that red beans are called kidney beans because they resemble a kidney. And if you don't feel like soaking your beans, blue runners are not a bad choice. Just get a
Okay,
little blue runners and smoked sausage, and you'll be all right.
there we go.
That's the
Now,
extent of my kidney knowledge. And you got
okay.
two.
Well, you went to the bean story, and I figured that was going to come at some point because most people know that. Now, a lot of people know that both you and I are from Louisiana, so that's the first thing that I'm sure everybody knows. Do you know the history around why people in Louisiana make red beans on Mondays?
I do not. I would just assume that it's something tasty to make you feel better after a Saints loss, because that's what I do.
I feel like that is probably better and more historical than what I'm about to say, but it definitely is spot on, at least this season, because my goodness,
My
atrocious.
God. There's plenty of red beans all this right now.
Red beans galore.
Red beans
So
for everybody.
yeah, absolutely. So I'll say this, and I'm not going to say I'm perfect at the story, but I will say enough to. I had to tell my student intern this not too long ago, but the idea, we went to the doctor's lounge to get some food, and in the doctor's lounge they had red beans, and I said the same thing to her. You know, are you aware that most people cook red beans on Mondays for a specific reason? It's not just because people like red beans, and she didn't understand or know it as well. But if I remember the story correctly, it's because when our people in Louisiana generations ago would have to get ready to do things for the week, they would basically do things on Sunday to get ready, right? So that would be washing
Mhm.
clothes, getting prepared for the work week. And to do that, they would have to go down to the river and wash clothes in the river with a washboard. So when you would go
Mhm.
down to the river to wash clothes, that would take a long time because, of course, there were no washing machines and you having to do everything by hand. So to cook, they would basically put on beans on Sunday, and they would cook all day Sunday into Monday so you could eat beans because you didn't have to watch them because it took so long to cook them the right way. So the red bean Monday came because people were cooking them starting on Sunday, going to the river, doing their washing, and then, of course, with all the washing and the time it took, things would be ready to eat late Sunday, early Monday, and that's where red beans on Monday came from. Again, I'm not perfect at the story, but I'm pretty close. I'm pretty sure. So,
That,
again,
that,
go ahead. Go
that's
ahead.
pretty. That's pretty fascinating. I like that. And look, I know you went to that fancy school up there in New Orleans, but I want to shout out Mayberry Hall on Southern University's campus. They have Red Bean Monday every Monday,
There we
and it's
go.
normally delicious. So shout
There we
out to
go.
Mayberry Hall.
And the reason why I bring it up, we already said we're not only entertaining, we are pretty educational around here. So consider
Mhm.
yourself educated on red beans if you did not know. And again, if you're in Louisiana, you're welcome. So, based off of
That's
that,
it.
Patient Zero, give us some of the background, if you don't mind, from the notes on kidneys and basically kidney disease, right? Anything that we can share with people, just a reason on why we are talking about this, other than the idea that, hey, kidneys are in the body and kidneys are important. We want to give people a reasoning as to why we're talking about this today. So let's share any information you can with them on kidneys, kidney disease, anything like that. And of course, we will fill it in with some statistics to back up anything we're saying. So I'll kick it to
Sure.
you, my brother.
So kidney disease is one of the most widespread, under-discussed chronic conditions in the United States, right? It's silent early on, so most people walk around just unaware that their kidneys are being damaged until it's advanced or irreversible, unfortunately. So kidney disease, it ties it directly into some of the biggest chronic issues in America, such as hypertension, diabetes, obesity, heart disease, inflammatory and autoimmune disorders. So your kidneys, they have to do with a lot, right? And
Hmm.
they are filters for your body, right? So it's
Correct.
important to keep them healthy because if you don't, a lot can go wrong, as you just heard.
Yep. So things that people should know is that, of course, as Patient Zero just gave a good breakdown on kidney disease and kind of the importance of it, the idea for us is that the kidneys are an organ in the body, and most people have two, some people only have one. But basically, the kidneys are quality control. They're doing this 24 hours a day, 7 days a week. They don't take a break, and they're working at all times throughout. Whereas some organs may be able to take a break because you're not using them. Think about your muscles when you're laying down, you're not really using them. They get to rest. The kidneys do not. So, based on them being the quality control on your bloodstream, they're basically cleaning the blood, keeping the good stuff in the blood, getting the bad stuff out. They do a lot of things from a function standpoint. They regulate your blood pressure, they balance electrolytes, they maintain fluid balance in the body so you don't get fluid overloaded and have, as patient zero likes to call it, cankles, which I think is a medical term we discovered not too long ago, several episodes ago.
Bill
It
Clinton made
fil-
it famous.
there you go. It filters toxins. It actually helps with bone health, and it actually helps with producing red blood cells. So if the kidneys fail, the whole body starts to basically suffer, and it can, of course, cause life-threatening issues. So all of this is important, not only for this episode, but just in general, right? It's important because a lot of people know they have kidneys. They know that the kidneys work, but they don't know exactly what they do. And if I say to you that they balance your electrolytes, they regulate your blood pressure, they maintain your fluid balance, they clear out toxins and filter your blood, and they support your bone health, like those 3, 4, 5 things, and there's more, we're hitting the high points, that should tell you that they're pretty important organs in the body. Should tell you. Now, some people may still not get it, but we're moving forward and can't bring everybody with us if they're on the slow bus. The idea for us is to basically give you a sense that your kidneys are important and you need to learn about them in order to hopefully prevent disease from happening. And patient zero, any thoughts on those things that we just talked about from a patient standpoint? Anything that you would say, hey, now that we're doing this episode, this kind of brings certain things to mind that I never even thought of or never even knew, just from a basic standpoint before we go into the weeds.
Nah, sure. So, just in my own experience, I get labs quarterly,
Mm-hmm.
like clockwork. Every once a quarter, I'm getting labs. I know my numbers, and something that you can watch is creatinine in the kidneys,
Mm-hmm.
right? And a lot of times that comes when you're not drinking enough water,
Mm-hmm.
and you need to drink a lot of water to keep the kidneys flush. That way they can act and behave like they're supposed to. Because with things like hypertension, that can blow your kidneys. Dehydration can blow your kidneys. So it's a lot of things that can go wrong within the body that hurt your kidneys. So you have to kind of maintain your body through everyday maintenance, kind of like changing oil in the car.
Yeah, agree. And I think ultimately a huge bonus of what we do in our clinic in the direct primary care model is that we have time to talk about this stuff in that detailed level where you just said, hey, blood pressure is going to affect it. Diabetes is going to affect it. Dehydration is going to affect it. What is creatinine? What does it do? How do you find it? Where is it located? All those things are things we get a chance to discuss when it comes up in terms of lab work and screening for our patients. And by us having more time to do that and really have that deep dive, it gives us an opportunity to detect disease early and, of course, do things to mitigate risk and problems. If we can stop the risk and the problems before they get out of control, we save you, we save your kidneys, and we save a lot of problems down the road. So,
Very true.
again, huge plug for direct primary care because we have time to do that. But ultimately, it gives us the opportunity for us to give patients what they need before they end up in a bad situation. So, patient zero, we'll go to second part of our first segment, if you will, and let's go into a little more detail about what the kidneys may actually do. So if you have any thoughts on that, I've already given you like some high level ideas of what they do. But let's talk in more detail about those things in terms of what they do or don't do. So anything you want to share with the folks, because there's two main purposes about what the kidneys do, two big ones. And I
Yeah.
already talked about them, but anything you want to kind of go over with so we can have that information.
So the kidneys, they're actually important for filtration and waste removal, right?
Yep. Yep.
So they filter about 150 to 180 liters of blood daily. Like I didn't even know you had that much blood in your body at one time. So that's pretty important, right? They remove metabolic waste such as urea and creatinine, medications and toxins, right? They keep the blood clean enough for every organ to function properly, right? Also, on top of that, they do fluid and electrolyte management. They balance things like sodium, potassium, chloride, bicarbonate, and other electrolytes that that you actually need in your body, but too much of them can actually be harmful, right? So the kidneys are very, very, very important. It also regulates how much water the body retains or excretes, and they prevent swelling or dehydration. So
So
again,
we'll stop right there because you done rattled off so many that I think people may just lose the idea of I didn't realize it did all that. Yes, you spot on. You just said they filter 150 to 180 liters of blood daily. So for the record, you don't have that much blood in your body. I wish we did, because then clearly you wouldn't bleed out so fast if something bad happened. But what it does is it recycles the blood over and over again. So
it makes
that
sense.
and I'm making it up, that 5 liters may go through your kidneys so many times in a day that you're filtering so many liters of blood daily. So it's not that you have a ton of liters, it's that the kidneys work 24 hours, 7 days a week. So you're filtering this blood over and over and over again. And by doing that, it allows you to keep a lot of waste and a lot of medications in the bloodstream. I'm sorry, I said that wrong. A lot of waste in the urine where it needs to go, and the medications potentially staying in the bloodstream when you need it, and then when you're done with the medications, you excrete them and you get them out. Of course, toxins need to go away, so it keeps the blood clean. So that's the biggest
Okay.
thing that kidneys do. They're a big filter, is what I tell people. So think like a water filter. You take water, you pour it through the filter, all the bad stuff stays in the filter, so you can throw it out. The water goes through into the jug, into the bottle, wherever you want it. So now the good, clean water stays, the bad stuff goes away. So your filters are like that, in terms of water filters, but your blood gets filtered through the kidneys as one of the main things. And then the other thing that is huge is the electrolyte balance. It keeps your electrolytes balanced to where you're not having too much sodium, too little potassium, too much bicarbonate, too much magnesium, all these other things that we don't often think about, other than when someone brings it up in different conversations from a medical standpoint. Most of the time, we don't think about our potassium level. Most of the time, we don't think about our bicarbonate level. So that thing that you're not having to think about because your kidneys work so well, it keeps your levels regulated. And I think the other part that a lot of people don't realize is if your kidneys work well, it also helps you not have too much fluid in the body in places where it doesn't need to be. So it takes fluid and gets it out of the body. And it also prevents you from being swollen and oftentimes being really, really swollen in different areas, whether it's your legs, your thighs, sometimes even your abdominal area and even your groin area. So those are the huge ones that I think. So PatientZero, what else you got? Because I know they got a few more that we wanted to highlight.
Sure. Blood pressure regulation, right? Um, I don't even know what that is. So it's ROS via
RAS,
the
RAS.
renin angiotensin aldosterone system.
So the
Came
renin
close.
angiotensin aldosterone system, the RAS system. So that's basically a system of hormones, and hormones that potentially get released into the body to make sure your blood pressure stays elevated, right? And we'll talk about that in a second. But that renin angiotensin aldosterone system, again, stuff most people never will hear of, never have to worry about. The kidneys do that on your behalf. So
Yeah.
if your kidneys are working, it's doing way more than you think from that system and a bunch of other stuff. But ultimately, it keeps the kidneys having pressure where it needs to be, not overloaded on pressure, not under emphasized on pressure, just right, right? The whole
Yeah.
Goldilocks thing, if that makes sense, PatientZero.
Yeah, clearly. Because I was wondering, what does Rasta have to do with your kidneys? I would assume jerk chicken and oxtails weren't good for your kidneys anyway, but whatever. I'm glad you cleared that up.
There we go.
Um, so your kidneys also respond to changes in blood flow and pressure, right?
Hmm.
They also help with hormones and bone and blood health. They produce
Something called
y-
erythropoietin. Erythropoietin. I wouldn't even want you to
that
try to say it. It's going to be over the top. But the idea is we say EPO for short. So EPO does what, PatientZero? This is the part a lot of people need to know.
it stimulates red blood cell production,
So
which
again,
is super important.
exactly. So if your kidneys don't work, you oftentimes have trouble making enough red blood cells. Red blood cells have one purpose in the body that most people should know. Most people
They
don't.
maintain the immune system.
No, that's white blood cells. Red blood cells basically carry oxygen. So red blood
Mm.
cells take oxygen from the lungs, put it into red blood cells, and transport it throughout your body. So if you don't have enough oxygen in your blood, the organs don't live. Brain doesn't live, heart, kidneys, liver, they all need oxygen. That's why, of course, we're not underwater having a ball. We need oxygen, right? So oxygen is often carried by red blood cells. If you don't have enough erythropoietin or EPO, the EPO or EPO doesn't produce enough red blood cells, not enough red blood cells being produced. Kidneys start to obviously fail. Where red blood cells aren't being produced, you don't get enough oxygen. So you start to basically get tired. You start to have shortness of breath and so on and so forth. So wanted to clear that up. Got a few more, and I think we'll be able to at least say we covered a lot of what the kidneys do. So I think 2 more, PatientZero.
Cool. It activates vitamin D for strong bones, which is also very, very important because without the vitamin D, your bones become weak and brittle.
There we go.
And it also influences calcium and phosphate regulation.
Correct. So you hit the nail on the head about strong bones, right? So vitamin D, most people understand vitamin D helps with bone health. If you have a lot of bone health, you're more than likely not going to fall and break a hip. You're more than likely not going to have a car accident and the bone breaks. So at that point, you're having a huge benefit where your kidneys are helping you with the bones from getting overly brittle. So I think that's a huge thing. And you also said calcium. And what is the big thing with calcium? Same thing, it helps with bone health. So if your calcium is regulated, your vitamin D is also increased. All these things are going to help you where you're not having weak bones and brittle bones. So, PatientZero, based off of that, what are your thoughts on kidney function and kidney health? Are you thinking that those are things you can sneeze at, as we would say, or take very lightly and just graze over it? Or is it something you think we need to probably focus on quite a bit when it comes to healthcare?
Now, I think it's something that you really need to focus in on because, when your kidneys struggle, it's not like kidney problems. It's actually whole body problems. When you're talking about anemia, bone disease, swelling, fatigue, heart issues, and eventually threatening complications, right? So, and look, just common sense, in my opinion. When you look at the body, you got one brain, you got one heart, you got one liver. The fact that you have 2 kidneys kind of means that it's pretty important, you know. So, I hate to get super spiritual because it's a factual podcast. It's not a testimonial podcast, but at the same time, radio show. But at the same time, you have to believe that your creator knew what he was doing when he designed this whole thing. And the fact that he gave you 2 should give you some type of hint that is pretty important for you to live.
Indeed. Indeed. And I think ultimately the other part is that it's not a one thing and one thing only, right? For the most part, most organs in the body do more than one thing, but the kidneys are one of those organs that are so multifaceted, have so many things that it can do. If you don't realize that until they're sick and pretty much depleted, it's at that moment you're going to say, man, I really should have took this more seriously because now I'm seeing all of the effects that these things are now no longer regulated. They're no longer in the right ranges. So now I'm dealing with what? A bunch of problems that I never even thought about because my kidneys just worked. I didn't have to think about all this stuff. Now I'm having to deal with all this extra stuff because now my kidneys don't work. And if I would have thought about it earlier and prevented it, it would have been so much better. All right, PatientZero. So we're going to move into the part of the show that I think a lot of people enjoy. I think you and I enjoy it the most because it comes down to math. And the math is the thing that we love most. Specifically, why, PatientZero?
Because Matt doesn't have an opinion.
There we go. So based on that, we're going to talk about stats in terms of kidneys and kidney disease and how all of those things tie in, because we talked about all the things that kidneys do and potentially how they are tied into so many parts of function in the body and what happens potentially when they don't work. But we want to know how much the kidney and kidney disease world affects people in today's society. And I think that's important because now, hopefully, when people hear it, they won't think, well, I don't have this problem, so I don't know why they're really talking about it. You may not have it, but a lot of your people around you probably do. And if you don't realize how many people are affected by this, you could easily become one of them. So PatientZero, let's give the people some stats. So go ahead,
Cool.
jump around. I know we got a lot of data that I pulled, and I wanted to make sure we had enough to cover. So feel free to run through as much as you want. And if anything stops you and you want to kind of discuss it, we'll do that.
All right, cool. So 37 million adults in the United States have chronic kidney disease. That's a lot of people, right? That's roughly about 15% of all adults, 1 in 7, right?
Mm-hmm.
So if you know 7 people, which most people do,
Mm-hmm.
odds are one of them have chronic kidney disease. That should be alarming and concerning in itself, right? Now, within this 1 in 7, 90% of people with chronic kidney disease do not know they have it. 90%. So out of 10 people that have it, 9 of them don't know. So with all the things that we just talked about that the kidneys do, right? All the things that they help, all the things they regulate, the fact that 90% of people don't know they have it, that should be alarming. That should make you want to run to your doctor today.
Mm-hmm.
I'm just saying, because the last thing you want to do is one of those people that rely on dialysis and miss a dialysis appointment, and all of a sudden you're in the hospital, right? And I don't want it to be all doom and gloom, but at the same time, this is very, very serious, right?
Mm-hmm.
Now, 1 in 3 adults in the United States are at risk of developing chronic kidney disease due to diabetes, hypertension, obesity, or family history. So diabetes, hypertension, obesity, or family history. Those 4 things hit everybody I know in Louisiana. Like somebody got a family history with one of those 3, if not all 3 of them.
Mm-hmm.
So that's important to highlight, right? Now, only about 6% of adults with early stage chronic kidney disease, which is stages 1 or 2, are aware of their diagnosis. So, long story short, chronic kidney disease is extremely common, but it's also very, very invisible, which is why early screening and long appointments matter.
Mm-hmm.
So you need to be getting your labs often. You need to have a thorough doctor who's going to go ahead and read off all your numbers to you and help you understand what these numbers mean. Because I've been in situations before where I've gotten a list of numbers, and on the test, they give you a range, right? They give you a range, was normal, was abnormal, was too high, was too low, and you're kind of on your own, right? So, you might get, for example, you might say, I got a lot of creatinine in my urine. What does that mean? You need somebody to break it down to you. So, this, I know it's going to sound like a PSA for direct primary care, but in my role, in my position, and my life experiences, I've taken command of my health, and I've had better experience since I've been enrolled in a DPC clinic, particularly the Byja clinic, in my opinion. So, this isn't to scare anybody, but I just want to get over how serious this is.
Yeah. So I'll add on to that, and we'll go into a few more statistics. So we'll talk about the difference in levels of kidney disease later in the show. But one of the things people will know is a term potentially called end-stage renal disease. End-stage renal disease is pretty much when the kidneys don't work at all and you're on dialysis. So that's the short version of that. But more than 800,000 people in the United States are living with end-stage renal disease as of today. More than 800,000 people in the U.S. alone. That's not counting other countries, other parts of the globe, but just in the U.S., more than 800,000 people. Approximately 550,000 of them are on dialysis. So again, you can have end-stage renal disease and not be on dialysis, but the majority of people who have end-stage renal disease end up on dialysis. And then those who are fortunate can end up hopefully getting a kidney transplant that allows them to not be on dialysis. So that goes into where you may have end-stage renal disease and end up not being on dialysis. There's something where if you're fortunate, you can get a kidney that literally works, that will allow you to get a kidney transplant and go from there. However, every year, about 130,000 people start on dialysis for the first time. And that's unfortunate because it's something that's pretty preventable, especially when it comes to the things that you just mentioned, when it comes to things like hypertension, diabetes, which are your probably 1-2 punch that causes most of that kidney disease that eventually progresses into end-stage renal disease. Ultimately, kidney disease is the 9th leading cause of death in the United States, and people with chronic kidney disease have 3 to 5 times higher risk of things like cardiovascular death compared to people without chronic kidney disease. So, all of that being said, most people with kidney disease typically don't die because they have kidney failure. They die because they have something like a stroke or a heart attack that came because the kidney dysfunction accelerated the heart declining, accelerated the blood vessels declining. So again, the kidneys may not cause the problem per se, but they're going to magnify other problems to where now they spin out of control. So those are huge things that we need to be mindful of. And PatientZero, I think I'm going to kick it over to you to talk about the part that I think will hit home for a lot of our listeners. It comes to race and ethnicity. So, sheer coincidence in your mind, who do you think potentially makes up the highest population of patients who have issues with kidney disease, if you had to take a guess?
So I don't need to take a guess. I'm gonna just go ahead and say Black people. And
Okay.
I do have the numbers in front of me, you know, and I hate looking at these type of numbers because it's very unsettling to me. But Black people make up about 13% of the U.S. population, right? But they represent about 35% of all people on dialysis. 13% of the population, but 35% of people on dialysis. So just doing basic math, 13 times 3 is 36. So approximately a Black person is 3 times more likely to end up on dialysis than somebody who's not Black.
Mm-hmm. Yep. And that's one of the main things that I hope our listeners, who more than likely are going to be in the African American population, will hear us when we say, we're talking to you, right? Like, we're not just doing this PSA for any and everybody. You're going to be the prime target, not only for this message, but also for hopefully the remedies that we are going to talk about. But more importantly, the issues that we're talking about are going to start having that same effect on you because you're going to be more at risk than those who are not in that demographic. I'll also mention really quickly, because we're going a little bit longer in segment 1 than we normally would like to. PatientZero, we have that talent to keep making the subject so entertaining that we end up talking for a little bit longer than what we anticipated. But the low income community has twice the rate of kidney failure than those who are not in the low income community. And of course, what do you think one of the main reasons of that, besides, of course, access to medication and access to care? It's basically the idea that they're getting diagnosed a lot later, right? So it's not just that, well, I can't get to the doctor. It's that even when you get there, you're going to end up getting diagnosed later because of limited access to things like primary care or evaluations of the kidneys in a thorough, detailed fashion. And then, of course, you don't have the funds to cover the cost of the medication or cover the cost of the treatments that are often recommended for you. Is going to cause more problems and more damage down the road. And PatientZero, I'll throw the last part of this segment to you. What part of the country do you think tends to have the most problems with kidney issues in terms of, let's go north, let's say northwest, southwest, southeast, and northeast? We're just going to do 4. We're not going to do Midwest because that gets tricky. So again, northeast, southeast, northwest, southwest. Which do you think is the highest when it comes to chronic kidney disease?
I mean, it's easy. The part of the country that ranks last in health It ranks last in income, ranks last in education. You know, I just, on the notes, Louisiana's the first state on the notes. We 50th in education and health and income. But my governor gets on TV and wants to talk about the LSU football coach with Pat McAfee, and I'm like, hey man, we we got
You
some
got some other,
problems
you got some other
that
things you
might
may want to tend to.
right. We got some problems that might require your attention other than Brian Kelly, but that's neither here nor there. So to answer your question, um, you're clearly talking about the Southeast United States. When you talk about Louisiana, Mississippi, Arkansas, Georgia, Alabama, they consistently rank in the top 10 for chronic kidney disease prevalence, right? Um, because we're eating the worst food, we're probably putting more seasoning and stuff like not the worst food for you, not the
There you
worst
go.
tasting food.
All right now. I was
Because
about
the
to say,
food's
you
delicious,
watch your mouth, sir. I was about to
right?
say.
The food's delicious. It'll kill you, but it's
Okay.
delicious.
You going out with a
So
smile.
yeah, you're going out with a bang. But when you talk about those areas, there's some of the poor areas, there's some of the the unhealthiest areas, some of the lowest educated areas. So I can understand why the rates are higher in the Southeast than anywhere else.
Yeah, absolutely. And I think ultimately, as you just said in the most eloquent way that I can put, it's oftentimes that we have the least in so many ways. So we end up kind of fighting for scraps, and the scraps we're fighting for don't really give us a huge return on healthcare because we're over here doing any and everything just trying to get to baseline, right? You're digging yourself out of a hole that by the time you get to ground zero, you're over here like, man, I'm exhausted. I don't even know if I have the strength to keep going on. So obviously, your kidneys are so crucial to you being healthy that now you're going to run into the problem of, like you said, low education, low economic resources, poor issues with getting to the clinic, or poor issues in terms of transportation, and the list goes on and on. It's a no brainer that the Southeast is going to be at the top of that list. And then, more importantly, the extremely southern states, Louisiana, Mississippi, Arkansas, Alabama, Georgia. I'm surprised Florida wasn't on there, which I would be hugely surprised that Florida isn't in the top 10. But all that being said, that just goes to show you that it's not changing if we don't do something different. It's not just going to magically fix itself. We need to do something better. So, based off of that, I would say ultimately we have work to do, my friend. So, we'll close out the beginning of this amazing episode. Patient Zero, any quick thoughts you want to leave the folks with when it comes to segment one?
It's funny because I feel like my quick thoughts are always the same. It's like get in care, get your labs, know your numbers, and get the help based on your numbers. Discuss those numbers with your doctor. And look, and if you haven't had a free consultation with Dr. Jasper yet, tell him PatientZero sent you. Not only will you get the consultation for free, but it comes with a bottle of water.
a cold bottle of water while we at it, right? Because some people may just give you that room temp.
You might need that room temp right now, man. It's kind of chilly outside, so I might need to put on the counter for some folks before they come. But
there you go.
Bottle of water indeed.
There you go. And my quick closing thoughts are that the kidney disease epidemic, and I'm going to use that word intentionally, I should say, that is not going to literally surprise a lot of people, especially if they are patients of ours or long-term listeners of ours, because we talk about this stuff regularly. But those who probably are listening for the first time, you are probably a little more surprised that this is so prevalent and it's not talked about a lot in a lot of situations. Oftentimes it's talked about when the kidneys are failing. It's talking about when the kidneys are about to literally no longer function. Well, we want you to learn about it on the front end so you're not having that problem. And if you are learning and listening and appreciating all the stuff that we're saying, please like, subscribe, share, follow, tag, all that stuff, and rate the show. Because again, we're doing the work to make sure you all are good and your families are good and your families' families are good. So please do that and stay tuned. We'll be right back after this commercial break.
Hi, it's Patient Zero from the Byja Radio Show. Are you tired of the broken healthcare system? Frustrated by long waits, rushed visits, and sky high costs? Yeah, I was too. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care written by our own Dr. Byron Jasper. It breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based care, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout and improves work-life balance for physicians, and so much more. Whether you're a patient like me, a doctor fed up with burnout, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. If you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today.
And we are back from commercial break. Patient Zero, we are talking about kidneys, and kidneys. Based off of that, we, I think, did a good job of covering a lot of things relevant to kidney disease. What is kidney disease for the most part? And of course, how many people are affected by it? And then given the function of the kidneys and how it works and all the stuff it does. So what we'll do in this part, segment 2 specifically of this episode, is talk about the things in a little more detail that cause kidney disease. We've kind of touched on a few of them, and we touched on a few of them enough to say, okay, these are the things that cause kidney disease at a very high level. But I think there are a bunch more that we need to highlight because some people don't know. And I had this happen where I'm literally talking to a patient and they told me this. And I'm like, I can't believe we're in 2025 still having this conversation because they just didn't know that that can cause kidney problems. So I'll give it to you, Patient Zero. How about you start with number 1? I'll take 2. We'll go 3 and then maybe go to 4 as well. So what would you say is the number 1 cause of kidney disease if we had to pick a 1 versus a 2?
I'm gonna say uncontrolled diabetes.
Okay.
You know,
So and I will give you credit because you didn't say diabetes, which I appreciate because people tend to think just because you have certain things, you're going to have a huge problem. It's not saying you won't, but if it's controlled, you oftentimes don't really know other things are causing problems because you're well controlled. So it's not just having diabetes, it's the uncontrolled part. So go on, Patient Zero. Let's give people a little more detail what you mean by that.
yep. Persistently high glucose levels damage kidney blood vessels. So we just talked about how much the kidneys filter blood. They help maintain that red blood cell count that's carrying oxygen through the body. If if you damaging the blood vessels to the kidneys can't do that effectively. That's gonna cause a problem, right?
Mm-hmm.
It leads to scarring, protein leakage, and progressive kidney dysfunction. And it's also called diabetic neuropathy. So uncontrolled diabetes will unequivocally damage your kidneys.
Yeah, and a small correction: diabetic nephropathy, neph like nephrology. Nephrology is the study of basically nephrons, which are kidneys. So not neuropathy.
Mr. H,
Neuropathy is nerve. So neuropathy is usually nerve.
can't, can't believe I missed the pH. I am out of line for that one.
Shame, shame on you, sir. Shame on you. So based off of that, you're 100% right. So kidneys have blood vessels. Pretty much everybody gets that. Diabetes, when it's uncontrolled, causes damage to the blood vessels. So now that the blood vessels don't carry enough blood or enough oxygenated blood to the kidneys start to damage. And the damage, of course, starts to cause things that will cause dysfunction in the kidneys, including things like protein leakage and so on and so forth. So, yes, we do have a lot of patients, even in my practice, that have diabetic nephropathy where the kidneys are basically not functioning because the diabetes is so poorly controlled. And what is the anecdote? A lot of people will actually say, PatientZero, when they come to the office and they have really good A1C control, but really bad kidneys? What do you think they think is going on at this point? Because you know what the
Yeah,
A1C is. We went over that.
right,
So
right.
their A1C is really good, but their kidneys are really bad. What do you think they think is going on?
What do you think? What do I think they think? I
Yeah.
have no clue. I would think it has something to do with your blood pressure, but I don't know what they think.
Well, most people think that when their A1C for diabetes gets really good and their kidneys are, in essence, really bad, they think it's just magically that their blood sugar is fixing itself, right? They just think, hey, my sugar used to be really high. Now it's really normal. I'm eating better. I'm working out. I'm doing stuff. Mind you, they haven't really changed much, but because the numbers are changing when they stick their finger or do blood work, they believe that their numbers are getting better. So their diabetes is getting better, or their diabetes is what? Cured. It's actually the opposite. When your kidneys start to shut down, it gives the false sense that your diabetes is under control. So people will potentially have really good A1C levels, but it's because their kidneys are so bad at filtering stuff that none of the sugar is going where it needs to go. It gets out of the blood and floats into other places in the body. So now their sugar level in the blood looks so good that they think, hey, my kidneys, even though they're not that great, my diabetes is getting better, so I'm good. And I kid you not, people whose A1C used to be in the double digits will all of a sudden drop into the single digits at 5 or 6, which is really good, but it's because their kidneys are so bad. So that diabetic nephropathy is not just saying you got a little kidney disease. No, this means you have such bad kidneys because of your diabetes, your A1C starts to actually get better, even though it's not really better at all. And that literally happened to a patient of mine this past week or so. And I'll talk about him a little bit later. But let's go on to the next one. So I'll take the second one, PatientZero, uncontrolled high blood pressure. So with elevated pressure, that destroys the delicate kidney glomeruli. Okay. And that's a crazy
Say it
word.
again.
Glomeruli. All right. So some people say glomeruli, but it's glomeruli, right? And one word, Glomeruli, glomeruli. And those things are basically the tubes that carry all the stuff. That's all the thing you need to know. It's like a bunch of tubes, right? So based off of that, when those vessels and those tubes get damaged, they end up getting thickened. They can cause stiffening of the kidney vessels, and it basically causes decline of the actual kidney function. So the second leading cause of kidney failure is hypertension. So high blood pressure tends to be the second cause. Diabetes is the leading cause. Okay. Number 3, PatientZero, which I know most people won't get, but you got the notes in front of you. What is the third leading cause of kidney disease?
A combination between diabetes and hypertension.
Correct.
So,
Because it's not mutually exclusive. It's not like you say, well, look, if the diabetes is tearing up the kidneys, the blood pressure going to take a break. No. They like double teaming, if that makes sense, right?
yeah. So it sounds like to me, you need to regulate your blood pressure and your blood sugar to
Mm-hmm.
protect your kidneys.
Yep.
But that's the most common pairing seen in dialysis patients. And
Mm-hmm.
it creates an exponential synergistic injury.
Yep. Exponential
Synergistic.
synergistic,
Synergistic.
like
So,
synergy.
okay.
There you go. So with those two things going off the chain, they literally, of course, cause damage on damage on damage. You already talked about how one can cause a ton of damage. I talked about how the other one can cause a ton of damage. You put them together, and it's just basically throwing gasoline on a fire. Okay, so we did 1, 2, and 3. Now these are the ones that I'm happy to talk about in a very quick way, PatientZero, because we want to be mindful of our time. These are ones that people don't tend to think of when it comes to kidney disease. And I'll be very surprised that people will say this as they're listening before we say it. Because if I said to somebody, what do you think are the common causes of kidney disease? Most people wouldn't even say diabetes or high blood pressure. So getting down to number 4 and number 5 and stuff like that, it's usually a huge surprise. So what do you think we should say is one of the main causes that people often overlook?
So I actually knew number 4. When you talk about chronic NSAID use,
Mm-hmm.
right? So you talk about like ibuprofen, naproxen, and similar drugs can impair kidney blood flow, right? So, I deal with a couple of herniated discs in my neck. I deal with some stiffness, some inflammation because of that. And one thing I have to be careful of is not to overuse ibuprofen and naproxen, because I don't want to create another problem,
Mm-hmm.
trying to make my neck feel better. I'd rather my neck hurt than to blow my kidneys. So,
Correct.
but that's the reason why I knew that. And, obviously long-term use is a major under-recognized driver of chronic kidney injury, right?
Yep.
So, when it comes to ibuprofen, a therapeutic dose is 800 milligrams, right? So that's what they call a therapeutic dose. Typical dose would be like something like 400. But if you keep 800, 800, 800, 800, you can damage your kidneys if you consistently do that. So you have to be really, really careful when using these type of drugs.
Yeah. And the NSAID, which is what you were saying earlier. So NSAID stands for non-steroidal anti-inflammatory drug. So most people don't realize when they go to the doctor and people give them steroids that they're giving steroids for inflammation, because steroids are anti-inflammatory. So NSAIDs, ibuprofen, naproxen, different things that you potentially take over the counter are non-steroidal anti-inflammatory drugs versus steroidal anti-inflammatory drugs. So NSAIDs are usually things you can get over the counter, whereas steroids that we tend to prescribe are things you got to get from the prescription side of things. Those are the ones that are going to cause a ton of kidney damage when they're used excessively and they're used in exorbitant doses. As PatientZero said, there are therapeutic doses that we recommend, and there are time frames that we recommend those doses are taken. When you try to self-medicate and think that, well, if 2 is good, then 8 must be better, then, hey, I'm not going to say that you're wrong when it comes to possibly pain relief. Most of the time you are, but I'm not going to say it. But at this point, the idea is that you're going to cause more harm than help. While you may get pain relief, you're going to end up causing more damage to other organs that eventually will cause deficiencies or decline. And those things will cause you to have more long-term effects that are bad. So keep in mind that some meds are good, some meds are even better, but doing them in excess is never a good idea. There are things that are going to happen when you take medicine outside of how most of the time the doctor recommends them. And my favorite, and I'm being extremely sarcastic, PatientZero, that I get is, I know my body and blah, 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 blah. So I know my body is the setup for me to say, well, why are you coming to me? Because if you know your body more than I do, you don't need my opinion. You don't need my medical expertise. You got it. But what you're saying is, I know my body. I need you to do what I say. And that tells me, hey, you are really and truthfully wanting me to listen to you and possibly cause you harm. And that's not something that we signed up for. So we're not going to do that. And I'm not going to overprescribe you anti-inflammatory, even if you're in a lot of pain, because there are other ways to treat the pain. And we don't want to cause your kidneys to fail. And the next
Right.
one that I'm going to throw out there, PatientZero, you already talked about it. I talk about it all the time, at least once or twice a week with different patients, because they don't realize that this is something that happens all the time that can cause kidney problems. It's recurrent dehydration. So this is something that we tend to see in a lot of people who have really poor fluid intake. The fluid intake is so poor that the kidneys don't get perfused from a blood standpoint. And if the kidneys don't get enough perfusion from a blood standpoint, there's damage, which then, of course, causes problems. So if you don't have enough fluid being taken into the body, you're going to have dehydration. Dehydration can cause kidney damage. So that's the biggest one. But other people have trouble with fluid intake and dehydration just because of other circumstances. So older people may have a hard time drinking fluid. People who are working outdoors and doing manual labor because they don't have the time to stop and get water because they're out doing stuff that getting water is going to be tough to do depending on the job and the job requirement. And of course, athletes, right? You're working out all the time. You're in the gym, you're out on the field, or if you're in soccer, you're on the pitch. You're doing all these things and you're not getting enough fluid. Dehydration will hit the kidneys and cause kidney disease. And we're not going to go into the specific name of the kidney disease that can be in these different categories, but the overall thought is you're not drinking enough fluid and hydrating, and you're doing all the other stuff. You got blood pressure issues, you got diabetes issues, you're also taking a ton of anti-inflammatories. It's just basically open season on the kidneys for getting beat up and getting damaged. And that's a huge, huge, huge problem that a lot of people don't realize. And by the time we see it, it's oftentimes too late. So PatientZero, are you surprised about the hydration or dehydration point?
Not at all. And I'm gonna add another one to it. If you're a chronic drinker, if you're out
Mm-hmm.
here being hungover all the time, that's just another form of dehydration. So, excessive alcohol abuse not only will affect your liver, obviously, but also affect the kidneys too. I just wanted to put that out there.
Yep. And again, we did a highlight of anti-inflammatory, but there are a bunch of other meds that can cause kidney damage as well. Other things that you put into your body that can cause kidney damage. So PatientZero just talked about alcohol. That's a huge thing. Smoking and vaping can cause it. Other medications can cause it. Over-the-counter supplements can cause it. A lot of things can cause damage to the kidneys because your kidneys are the filter for your blood. And if your kidneys are filtering your blood and you have excessive amounts of fill in the blank in it, the kidneys have to then work overtime trying to filter all of that out. They start to get damaged and worn out. And that's going to be because you're putting the wrong stuff in the body. So those things in a big, big category, we call them nephrotoxic agents. Nephro meaning kidney, toxic meaning toxic. And of course, nephrotoxic means that the agents you're putting in your body are causing kidney damage. So when we say a person has a lot of nephrotoxic things, that's just telling us we have an issue that we don't want them to keep doing the ingestion of stuff that is causing damage to the kidneys. And we haven't even gotten into other things, PatientZero, like immune mediated causes. So immune disease where the kidneys are attacked by the body itself. So this is stuff like lupus. Lupus can cause kidney damage. And a lot of people don't know that lupus, one of the main, if not the main cause of problems for people with lupus is kidney disease. Lupus attacks the kidneys. So that's a huge thing. And then you have other stuff like vasculitis, where the vasculature or the vascular system has inflammation because the body is attacking the blood system and the blood system can't pump blood to the kidneys. So the kidneys now get damaged. And that's just the body doing damage itself. That can be lupus plus anti-inflammatory disease, lupus plus supplements, lupus plus diabetes. So all these things are things that can happen in a wave, and the wave can literally just get out of control. So those are just some of the things that cause kidney disease. And I think that's important to highlight those extreme cases, diabetes, high blood pressure, more common cases, anti-inflammatory disease, anti-inflammatory overuse and dehydration. And then some of those rare things that we don't talk a lot about, but those are all relevant and all of them can go on. And you may not ever know, because if you're not going to the doctor because you feel fine, you're going to find out on the backside that probably weren't feeling fine. It's just it hadn't caught up with you yet. So PatientZero, any thoughts on those things? If not, we can hop into the part that I think is also very helpful, which is kind of differentiating acute versus chronic disease. But go ahead and tell me if you got any thoughts on the common causes portion.
I think you just gotta be careful. You got to be careful that number one, you you always going to the same doctor, right? Like that's why being enrolled in the clinic is so important, because what'll happen is, just by reading these things, you in that traditional model, you can't get to the doctor, you're not feeling good, then you go to urgent care. You go tell the urgent care doctor or whoever what you want, and they just give you what you want. So a good example is, let's say I'm sniffling, and the weather just changed a little bit. I might have some cold-like symptoms or whatever. So I'm convincing the urgent care staff to give me a steroid shot and some antibiotics because I just want to feel better right now, right? But they don't know that I'm over abusing ibuprofen because I'm dealing with neck pain, or I'm trying to avoid hangovers and partying or whatever. And now all of a sudden, I got all these things attacking my kidney because I'm dealing with healthcare professionals who don't know me, and I'm telling them what I want, and they just give it to me. You know what I mean? So I think, you know, just listening to all the things that can and will attack the kidney and having all these different causes, you know, which to me is, it sounds like a bigger reasons to get in care. Not only that way you can know your numbers and prevent things, but also that way you got somebody who's managing your prescriptions and the things that you're taking every day. So it's just a smarter way to approach things. That way you're not robbing Peter to pay Paul and damaging one part of the body to save another.
There we go. And I think ultimately, the part I would say from that brief overview is that these things can literally happen whether you think it can happen to you or you don't. So going to the urgent care, which sounds great, and not being in the continuous amount of care doesn't really dawn on you how that can be a problem until it's often too late. I had a patient this week who literally called me, and I'm going to say, as of this recording, he's not a patient of ours, but I say a patient because he's like, I met you at an event and I'm not feeling well. I'm having some issues, but I wanted to see, can I do a walk-in? And I was like, well, we don't typically do walk-ins because, you know, we want you to get in care. We want you to have continuity. But I said, I do think if you do really, really feel bad, you want to go to an urgent care, that's not a bad thing. But more than likely, when you're done at the urgent care, they're going to tell you need to follow up with the primary care doctor. Unfortunately, I hadn't heard back from that person. Now, my hope is that they found a primary care doctor, but as you just said, it's good for you to possibly go and feel better quickly. However, if you don't get the issue addressed at the root cause and you only treat the symptoms, eventually those symptoms can get out of control and cause problems for something like what we're talking about now, that overall kidney problem that we just never thought about because no one's checking your kidneys at an urgent care. They're not going to do blood work to check your kidneys. I already know that. PatientZero, anytime you've been in urgent care, do you ever recall them checking blood on you? And then if they did they ever talk to you about your kidneys after they check blood?
No, I've never had anybody really talk to me about my kidneys other than you. So,
Mm-hmm. Yep.
and
So,
I'm not taking shots at any of my former doctors. I'm just saying, like, I don't recall those conversations where we've talked about the kidneys at all.
mm-hmm.
Now,
Yep.
maybe my numbers just look so great to where they was like, we don't need to worry about it, or maybe that was ignored. I don't know, but you're the only person I've had conversations with my kidneys about.
There we go. Okay. Well, that takes care of what I was trying to get at, and I'm glad that you were able to say it. I was going to assume that, like you said, maybe they checked your blood but never really talked to you about kidneys. But you said exactly what I thought. It probably didn't happen at all. So with that, we now have talked about the common causes of kidney disease, but let's specify what are the actual levels of kidney disease. So PatientZero, I'm gonna kick it over to you. Let's start with the two things that are the simple overarching definitions for acute kidney disease and chronic kidney disease.
Okay, so an acute kidney injury, which is AKI, it's a sudden drop in kidney function over hours or days, right? Often due to like dehydration, infection, medication, or sudden blood pressure changes. But the thing to note on this one is it's frequently reversible with rapid identification and treatment.
Mm-hmm.
So it's one of those things where if you catch early, you can actually reverse it. Now, on the flip side of that coin, you got chronic kidney disease, CKD, which is persistent long-term decline over months to years. Again, months to years. So if you're not getting your numbers quarterly, that could be dangerous to where if you just don't know. But it's caused by chronic conditions like diabetes, hypertension, or an autoimmune disease like such as lupus, that we just talked about, right?
Mm-hmm.
And it's often irreversible once scarring has occurred.
Perfect.
So, go ahead.
I was going to say perfect. And I think that part is the part I want to drive home. Acute kidney injury or acute kidney disease can be reversed. It can return back to normal if you catch it early and you address the problem that's causing the issue. Chronic kidney disease, once it's gone, it's gone. Once you've lost function, I can't get it back. So that's why we're so importantly, aggressively talking about this, because we want you to hear that you got to get it checked and you got to get it fixed. Because if you just say, I'm going to do it later when I get time, you may not be able to get it back once it's gone. So go ahead, PatientZero. I'm sure you had other parts that you wanted to highlight that makes a huge difference when it comes to acute versus chronic. But those two, I think, are the biggest points.
I think you said exactly what I was going to say in terms of being reversible versus often irreversible. Also, how fast that you catch them.
Mm-hmm.
Because if you're doing some things temporarily, sometimes your body will heal itself if you're not chronically punishing it, right?
Mm-hmm.
So, just that's why it's so important to be, to quote unquote know your body and to be aware of certain things. Like a good example, you talk about sudden drop in kidney function over hours and days, right? So, again, you're the expert, not me, but just in the world according to PatientZero, if you're used to your urine being a certain color and all of a sudden it's just darker for a day or two, that might be a warning sign that you might need to make a phone call.
Yeah.
Or if you're not urinating as often, that might be something to watch. Or if you have fever or something, you might want to be careful, and you might not need to wait for your quarterly labs to say, okay, there may be a problem, right? So that's just something that you can kind of look out for, because the last thing you want to do is let that bleed over into this months to years period, and now all of a sudden there's not much you can do outside of losing a kidney or maybe having a kidney transplant if
Mm-hmm.
both of them are going bad. You know what I mean? So
Yep.
just pay attention to your body.
Yep. And I will say that, speaking of the urination part, somewhat of a segue. I had a call today, literally from a patient who called and said something has to be wrong. And I said, oh, okay, well, what's going on? What you got? Like, what's causing you to feel like something's wrong? I'm going to the bathroom too much. And I said, okay, well, let's talk about it. What do you mean? And we just go through all of the questions that I would ask from the doctor standpoint, only to find out that this person is going to the bathroom frequently because they drink a lot of water. And I said, you're actually going a lot is a good thing. It's telling me your kidneys are working. It's telling me that when you go and you're making urine, the urine is clear, close to water, which means that your urine is actually very, 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 very diluted. And diluted is somewhat a good thing when it comes to your urine, because we don't want it to have a bunch of stuff in it that shouldn't be there. And that person was pretty surprised and relieved. They were like, I thought going too much was a problem. I said, well, in a way, it can be disease oriented. But if you don't have any of these things, we also just checked your labs and your labs actually look pretty good. I don't think it's anything to worry about. Now, if you want to come in and check them again, we can, but I don't think you have to, because you're doing everything that I ask you to do. You're not doing the things that we shouldn't do. We've checked you to know that you're in good health, and you're actively doing all the right stuff. So it literally was more of a reassurance thing, which is a good direct primary care thing, because that person didn't have to come in for a visit. We didn't have to do any extra labs just to tell them they're fine. And all it was is, I just need to talk to my doctor sometimes to get us off the ledge. So DPC won in that example, but it just goes to show how quick the misconception can be. Going to the bathroom too much is a problem. So I need to do something else, because now that I'm going too much, I must have something wrong. So now you just go down the rabbit hole of misinformation. So huge, huge, huge benefit to that person and the model for us getting that opportunity to do that and do it in that very specific way. So, all right, PatientZero. So we're going to get to this last point, and then we'll potentially close out, because I think we're kind of getting up into the higher end of the show. I want to spend the last part, maybe the second to last part, talking about chronic kidney disease and the levels. So we know there's an acute kidney disease or acute kidney injury, and there's chronic kidney disease. And we talked about the difference between those two. So, PatientZero, offhand, do you know how many levels of chronic kidney disease there are? And I'm going to say there's numbers, right? It's not letters. It's not specific combinations of words. It's literally just numbers, right? So numbers like 1, 2, 5, 7, 8, 10, all of that. What would you say
So,
are the number of kidney disease rankings, if you had to take a guess?
so what I would say is there's 6 rankings
Okay.
because it's 1 through 5. And on 3, there's 3A and B.
Okay.
So it's
Okay.
6.
Okay. So I will give you credit on that one. There are technically 5 stages. of CKD or chronic kidney disease. And yes, there are 2 within level 3, so 3A and 3B. So patient 0, let's go over 1, 2, 3, 4, 5. We won't spend a ton of time on it because I don't think it needs to be over the top. I'm glad people have an idea that there are now 5 stages. Once you get past stage 5, you're pretty much at the end of the stages, aka end stage renal disease, aka you probably need to be on dialysis. But let's talk about the first 1, 2, 3, 4, 5. So patient 0, what does stage 1 signify?
So stage 1 signifies that there's kidney damage or reduced function for 3+ months,
Gotcha.
right? And that's defined by a decreased GFR, protein or albumin in urine,
Yep.
or structural abnormalities. And chronic kidney disease is a spectrum, not a single condition.
There we go. So stage 1, in terms of, hey, you have chronic kidney disease, as patient 0 just mentioned, you can definitely have things like a decreased GFR. GFR stands for glomerular filtration rate. So we talked about glomeruli earlier. So that GFR, that filtration rate, where the part of the kidneys is trying to filter things. And if it has a high rate of filtration, it's working really well. If it can't filter things because it's overworked or it's burned out, it has a low filtration rate. So when the filtration rate starts to drop from whatever the number is to a lower number, your kidney disease is progressing. So in stage 1 specifically, you have some damage, but it may not be as significant to where it's going to show up on blood work. So your GFR is going to potentially not necessarily be abnormal on blood work, but you do have evidence of damage. So you may have something like protein in your urine. And one of the proteins that we look for in the urine is something called albumin. Albumin is a protein. I won't go into a ton of detail of what albumin does and how it works, but albumin being a protein will potentially end up in the urine and it shouldn't be there. So when you have protein in your urine, even though you're not seeing it in the blood, the protein is in the urine because the filter isn't working. It's now in the urine. The blood is now not showing damage. The first sign is, hey, you start to have protein. Dr. Jasper is going to say, patient 0, you got maybe a little kidney disease going on. Well, look, my blood is normal. What do you mean? Well, I'm looking at your urine and you got some protein in there. Okay, well, patient 0, would you have symptoms in stage 1, do you think?
There's no symptoms.
No symptoms. Exactly. So that's the part of it that we don't want to wait until you decide, oh, I'm having symptoms. Now let me get checked. We want to catch it at stage 1 and hopefully leave it at stage 1, because at that point, now that you're at stage 1, we can't go back to normal 100%, but we can stop it from going to stage 2. All right, patient 0, what you got for stage 2?
Mild drop in function, so a little less functionality, but there's still usually no symptoms.
Correct.
So I'm assuming that your numbers will look a little different. There's ways you can tell, like you just described, but still usually no symptoms. So you got to be checking on yourself and looking at these numbers, because there's no other way to tell.
Correct. And that's the thing. So again, there's different levels, and we're not giving you all the numbers because the GFR is a number, right? It's a rate. So imagine 0 to 100. Your stage 1 may be from 0 to 90, and stage 2 may be from 89 to 72. Like, it's not all categorically like every 20 points it's a stage. The stages are different, but the point is as your function declines, you're going up in stage, your rate is coming down. So in stage 2, still no symptoms, but yes, your filtration rate is still going down. So you'll still have symptoms that are not necessarily showing up, but there's signs that are showing up. And again, function is going down on the rate, may have more protein in the urine. Then we get to stage 3. Stage 3 has 2 stages, as you said, patient 0, A and B. So now we have a moderate loss of kidney function to where you probably are going to start to see this in your bloodstream. You're probably going to see a lot of protein in your urine, and you start to have complications. Things like anemia, things like bone and mineral issues, things like swelling of the lower extremities, and elevated blood pressure. Those are all signs of progressive kidney disease. And stage 3 is when you start to see that, when people are like, oh, well, I don't realize why my pressure is so high, or I don't realize why I'm having so much swelling on my legs, I don't realize why I feel tired all the time. We check their labs and we find out their kidneys are bad. And at that point, it's like, look, your kidneys are so bad. I don't think we can reverse it, but we're going to try to stop it from getting worse. And if we can stop it from getting worse, you'll feel better. So that's a huge part of stage 3. And I'll throw these numbers out there around for stage 3 just to give people a sense. So if we're 0 to 100, stage 3 is when you start to get around 60 to 45. And if not 60 to 45, it's like 60 to 30, something like that. So if you're around 100% filtration rate, now we're down to 60, that may be 3A. Then by the time you get to 40, you're at 3B. So at that point, again, out of 5 stages, we're almost to 4. You're dang near at 40% function. And that's pretty significant. And at that point, we got a huge amount of work to do to try to stop it from progressing. All right, patient 0, stage 4, what you got?
So stage 4 is severe damage, more symptoms like dangerous electrolyte abnormalities. I can't talk tonight. Dangerous electrolyte abnormalities may appear, right? And it prepares for future dialysis or transplant. So that's stage 4.
Yeah. So again, you're not quite at end stage renal disease where dialysis is happening, but at 4, we're getting you ready. We're getting you ready. Okay. At 4, we're getting you ready for dialysis. So you're not even there yet. We're proactively saying, let's go and get you all the stuff you need because you're pretty much headed there, right? We know that's coming. So then you get to stage 5, and stage 5 is pretty much when you're getting to that level where you're almost end stage renal disease, if not literally on the precipice of end stage renal disease, right? You're knocking on the door. So that is when your GFR, your glomerular filtration rate, is under 15. Under 15. So the kidneys cannot sustain life without dialysis or a transplant, and you have severe swelling, severe fatigue, severe things like nausea, itching. You have mental fog or brain fog or cloudiness of your thought process. And of course, you're overloaded with fluid. And it's a perfect segue, which may allow us to get to the last point of this episode. So patient 0, if you have an idea on why we tend to come up with these topics, what do you think happened that may have informed this topic? If I had to throw you that potential question, what do you think happened?
I think you had a patient that complained about some symptoms and was at 4 or 5, stage 4 or 5 chronic kidney disease. And now he or she may be dealing with dialysis or maybe on the cusp of dialysis. But is too advanced to maybe reverse some of the issues.
Yep. So patient calls and says in so many words, they feel like they need to get a new doctor because they're not sure if the doctor they're seeing is the best fit. I'll give you the short version. I say, sure, we'd love to get you in. Patient has very, very small amount of insurance. And I use the word small because the insurance doesn't do a whole lot, right? So the patient's coming in, doesn't have the best insurance, and is worried about, in essence, not feeling well and worried about swelling. Where do you think the swelling was noticed?
In the lower abdomen, maybe in the back,
in the pelvic
around where
area.
the kidneys should be. Oh, okay.
In the pelvic area. It wasn't because they had chest pain or shortness of breath, or they weren't having fevers or chills. They had swelling in the pelvic area that was causing some problems with their, of course, sexual performance. When they come in with that, that's what their prompt was to get into care. By that point, we go ahead and do some labs. The patient has stage 5 kidney disease and needs to literally go to the hospital because at this point, they are literally needing to be dialyzed. They need dialysis in order to potentially stay alive. Because when the kidneys stop working and you're now having so much swelling that it has went from your feet to your ankles, to your calves, to your knees, to your thighs, into your pelvis, it's just a matter of time before it fills up into the abdominal area and you're now so overloaded that you're basically now going to, in essence, have no function of anything other than the bare minimum of your heart beating, right? On top of that, this patient is needing dialysis, and it's not quick to get dialysis. It's not like you hit a button and dialysis just happens. Dialysis means you got to have a surgery to put in something called vascular access, where they now hook you up to a machine, and the machine takes your blood out of your body, filters it for you, and then puts the blood back into your body. That's what dialysis is. It's not where you're literally going and getting a microwave treatment and it's quick. It takes several hours because you have to sit still, be attached to a machine, and the machine now has to clean your blood like we talked about 24/7. That machine has to do the work of your kidneys in a very small time frame, and it doesn't happen where you do it once and you're done. How often do you think people need to go to dialysis, PatientZero?
Is it once a week?
I wish 3 times a week. That's the
Oh
minimum.
Lord.
So most patients go to dialysis Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, every week. So how do you think they get to travel?
They got to plan to have dialysis on the road, I
Correct.
guess.
Either one, they don't, or they have to now coordinate where they can go and get dialysis when they travel. They have to possibly get insurance that will cover them to get dialysis outside of the state that they reside, or they have to worry about paying for it out of pocket. So all of that is now in this patient's future. The patient now has an actual vascular access. They were dialyzed in the hospital for 3 days straight. Then they get discharged and now have to go to dialysis 3 days out of the week. All because weren't in care, or if they were in care, they weren't following the instructions, or whoever they were in care with wasn't doing a good job. All of this can be avoided by getting your blood pressure under control, getting up and moving, getting up and taking the medicines that you should, and more importantly, getting into care with someone who really and truthfully works with you. And I say that because you may not get along with every person. Doesn't mean you have to keep seeing them. You can switch to a doctor or a clinic that gives you the care you need. But for you to now have to go and be attached to a machine, have all your blood taken out of your body, if not all of it, the majority of it, have it cleaned by a machine, then put back into your body, that takes several hours. Then it makes you feel horrible. I don't mean horrible like nausea, vomiting horrible. It makes you feel extremely tired. Because again, I'm pulling all of the blood out of you. So all of the blood is now drained out of you. You feel sluggish. You feel tired. You feel really, really, really bad. And now you get 1 day to feel good. And then you got to do it all over again. 3 days out of the week, my friend, for the rest of your life, unless you get what? A kidney transplant. Is it worth it in your mind? I'm sure it's not. And it's definitely not worth it in mine. After I saw it one time, I was like, you ain't never got to tell me nothing. And my favorite part, hopefully if a person's listening this long, what do you think I have to say to people when they say, well, I don't want to take no medicine?
Well, I've heard you tell people that before, where like, well, or you could risk getting a stroke, you could risk having a heart attack, or you could risk getting on dialysis, or you just wake up in the morning and just take this pill. It's up to you.
It's up to you. My first word is, all right. I'm not going to sit here and argue you down. I'm going to tell you what your risks are. I'm going to let you know that if you do not follow the instructions, change your lifestyle, change your diet, get up, get moving, this is what you're going to get. I don't know when. I don't have that magic ball, crystal ball, 8-ball, whatever. I don't have it, but I know it's coming. And when it happens, there's one thing you won't ever say. He didn't tell me. Because I guarantee anybody who knows me, if you're in care and you've been around me, I've told you, and I will tell you until I'm blue in the face. Whether you listen or not is up to you. So you don't have to take no medicine. You ain't got to do a goddamn thing. Nothing. Do whatever you want. But at the end of the day, whenever you're now attached to a machine 3 times out of the week for several hours out of the day, that's pulling all the blood out of your body, cleaning it and putting it back, and you got to then wash, rinse, and repeat. Because besides that, PatientZero, do you think they're no longer on any medications?
No.
Oh yeah. So they're on more medication now being on dialysis
Right.
than they were before they went on dialysis. So you're now taking
1,000%.
medicine based on what you told me you didn't want to do, which is what you didn't want to do in the beginning. I don't want to take medicine. So how ironic is it?
Very.
So
I would rather just take the pill, but that's just me.
yeah.
Or significantly change your lifestyle.
And if you can do that, you may not need medicine, but at a certain point, you still may, because again, we're not immortal, right? We're going to possibly need some help. That's just the way it is. Just like as people get older, they may need help with glasses. Doesn't mean that you're not a good person and you're not healthy and da. No, it just means you need help. So if you got to take some medicine, in my mind, if it allows you to be on this earth longer and spend time with your loved ones, let's do that. All right, patient zero. So I think we went long enough. We talked about kidneys and more kidneys. We taught the people about Red Bean Monday. We talked about health issues related to kidneys, the difference in kidney disease from acute versus chronic, the different stages, and all the things that cause it. With that, patient zero, what do you want to leave the people with from a closing thought standpoint, if you must?
Well, I just say get in care. Get in care. Pay attention to your body. You know, a long time ago, you know, when I had hair, believe it or not, I wasn't born bald. But we would always say when you go to a different barber, your line gets pushed back because that barber don't know your line. So what you want to do, you want to pick a barber, you want to roll with him. That way he can roll with your natural line. And look, I knew I was in trouble because, man, when I was younger, my barber used to do my line in bed and not pay attention. But then toward the end, he had to get off the phone. He had to take a few steps back, look at me good, and make sure. And look, and if you call Q Quentin Tillison at Wells Barbershop, he'll tell you the story. But toward the end, he was focused. He couldn't help it. He couldn't save it. But I said all that to say this: when it comes to healthcare, it's a similar thing, right? If you want to play Russian roulette with your health and go see this person, go see that person, go see this person, your health is going to get pushed back because that person don't know your experiences, maybe what you're allergic to. You know, I guess there's he could look at your chart or she could look at your chart, but that's different from somebody who actually knows you. So I said all that to say, if you want your health to maintain and to actually improve, you need to pick a physician who's going to, A, take the time to deal with you, but also, B, you keep going to that same physician. Find somebody that works for you and keep rolling with them. And that way your health or your line don't get pushed back. So, you know, give DPC a try. Call Dr. Jasper. Tell him I sent you. And get that free consultation and see if it works for you and give it an attempt, because this is the healthiest I've been in my life because I know what I'm dealing with and I know how to fix it.
Absolutely. I'll close out by saying, as Patient Zero said earlier, if you're fortunate and you're, blessed to have two kidneys, because we have some people who don't have that when they are born, but if you're blessed to have them, keep them, because believe it or not, they are literally doing more than you can ever imagine, and they keep you on this earth and having less complications than a lot of people. And if you don't value them, they are going to go. And once they're gone, you can't get them back. It's not where you can get to stage 5 and then go back to 1. It's not where you can get to 3 and go back to 2. You have to literally stop them from declining on the front end. So when you get older, you have all of the reserve. And then, of course, if illness happens, you've got so much of reserve, it's not going to tip you over into end stage renal disease. Also, I will say to all of the barbers out there with Patient Zero, I saw some of these pictures. Dude was fly when he had hair. I mean, I'm just going to say it because people would not be surprised by saying, okay, Patient Zero may have, just been born bald, because that's all I've ever known him as. But nah, man, dude had a full set of wavy joints going on. And I really I'm just pleasantly surprised that people may not give you the credit of the long, luscious locks that I know you potentially had, my friend. Like, I just think that's disrespectful if the barbers didn't give you your just due when you had, what you had going on, my friend.
Yeah, man, it's super disrespectful, man. But shout out to Q at Wells Barbershop, man. You know, he kept my taper fresh and my waves dipping for a long time, man. You know, just Mother Nature decided it was done.
Yeah,
so,
she was a hater. I could see that. No worries.
She definitely hated.
Well,
man,
with
I
that,
was in the gym one night and saw that Carl Winslow hairline. It was over. I just, I knew I had a good run.
Oh man, and my question is, did you have a ceremony, or you just went to the bathroom and got rid of it?
Nah, man. Look, I went to the barber the first time. I went to the barber the next day. I said, "Babe, cut all this off and make sure my beard's tight." And then from there on out, man, I got me a Gillette Pro Glide and went my wave pattern, and it's a wrap.
Been right ever since. There you go. Well, I appreciate the candid nature, hence the idea of the gumbo in the room, man. Look, you got all the substance, brother. I'm just here to add the flair. That's all it is.
Yeah, man, you're doing a great job, man. We need to keep this up, so we need to make sure we don't get canceled no time soon.
Here we go. Well, in order to do that, PatientZero, tell the people where they can find you outside of the Byja Radio Show and any other messages you want to give to them, and I'll do the same.
Well, so you can always find me at on Twitter. I'm still calling it Twitter. Say what you want. At George_Becknell. LinkedIn, George Becknell II. Becknell Media on Instagram. And those are the typical places you can find me.
Okay. As for us, you can find us on our website for the clinic, www.byja.org for Byja Clinic, for our nonprofit organization that supports the clinic to help people get access to care that is affordable and equitable. You can find us at www.byjaca.org for the Byja Charitable Alliance. You can also find us on social media at Byja Clinic, on Instagram and Facebook, on LinkedIn at Byja Clinic as well. If you haven't done so already, check out the Byja Blueprint book, the introductory guide to direct primary care for businesses, doctors, and patients. And more importantly, if you have not done so to this point, PatientZero, I think you can agree they should have liked already. They should subscribe or follow. They should be sharing, they should be commenting, and they should be rating. Because again, at this point, we're giving away all this free education and entertainment. And we may not be doing all the happy singing, dancing, and clapping, but I do believe we should at least have more ratings of 5 stars. I mean, I look on our ratings and I'm like, man, we haven't had a rating in so long, but we keep hearing people shout us out, tell us they like us and all this. So I'm talking specifically to you. If you literally are listening to us at this point and you haven't done this, we are specifically talking to you that you need to go and rate, like, subscribe, share, follow, all that, because that helps us know we're doing the work. And again, at a certain point, when we just hang it up, it's your fault. I'm saying that. I feel like that's right, PatientZero. What are your thoughts?
Nah, man. I mean, that's right. Like we 40-something episodes in, man. Like, you know, and people stop me in the streets, call me PatientZero. I think it's hilarious. I did shout out to my good brother Robert Johnson. I walked up to a service project, turkey giveaway. He's like, "Hey man, look, it's PatientZero." So man, like just give us a little, give us a little rate. It ain't gonna hurt you.
There we go.
And share it with a friend.
There we go. I think that's simple. That's easy to do, and it don't cost nothing other than some time. So with that, we appreciate you all for listening. We are pretty much to the middle, if not tail end of season 4. I think we got a few more episodes this season, PatientZero, and I think the people will enjoy it. But again, thank you all for listening. We will see you next time.